All right, welcome back to ABA Exam Review and the continuation of our BCBA practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Greg is designing an intervention for a child who engages in hand flapping during academic tasks. A functional assessment revealed that the hand flapping often increases when the child is presented with difficult tasks and decreases when the tasks are removed. Greg's intervention involves providing frequent, non-contingent access to highly preferred sensory items throughout academic sessions. This intervention primarily attempts to decrease hand flapping by doing what? All right, we're starting off with a long question. And what do we do when we see a long question? We don't panic. We just attack it and we try to gather information. Long questions are not intimidating. Just because they're long doesn't mean it's going to be difficult. So we have an intervention aimed to decrease hand flapping. Now, why is the hand flapping occurring? We know the hand flapping occurs during academic tasks. The assessment shows hand flapping increases with difficult tasks and decreases when tasks are removed. So as an analyst, what would your hypothesis be? Well, escape is the function. So we're trying to do something about the escape, right? Hand flapping seems to occur to get out of a task. Now, Greg is trying to give frequent non-contingent access to sensory items. When we use non-contingent reinforcement, typically what we're trying to do is trying to satiate our client and decrease a motivation, right? Motivation to do something. So all this said, escape is likely the function. We're likely trying to satiate or abolish a motivating operation. What is the intervention trying to do? A, provide a competing response that is incompatible with hand flapping. Now, just because we're giving highly preferred sensory items does not mean they're going to be incompatible. Nothing about what is said in the question indicates it's going to be incompatible. A is out. B, abolishing the motivating operation for escape from difficult tasks. Sure, when we're using non-contingent access and trying to eliminate the problem, which is escape, we're trying to abolish the motivating operation to actually escape. Now, hand flapping is occurring to escape. Will the non-contingent access stop the hand flapping? Maybe not, but we are trying to abolish the motivating operation for escape. So B looks okay. C, differentially reinforcing alternative behaviors to hand flapping. Nowhere in the question, after we attack the question, does it say Greg is differentially reinforcing anything. C is also out. D, functionally equivalent replacement of the sensory consequences of hand flapping. Nowhere does it say that the hand flapping is functioning for sensory reasons. So by attacking the question, we can eliminate A, C, and D because no information in the question points to any of those answers. So the best answer, and the only one that is supported by any of the facts in the question, is B. This is why we attack the question. Jane is consulting for an organization implementing a new performance management system for their employees. The goal is to increase the rate of timely report submissions. Jane proposes a system where employees receive points for submitting reports on time, and these points can be exchanged for desirable workplace incentives. This intervention is primarily leveraging which of the following behavior principles to increase report submission? Another long question. Doesn't matter. We're just going to attack and gather information. We're looking at the intervention, and the question wants to know what principle is this intervention trying to leverage? What do we know? We know Jane is consulting for an organization. The goal is to increase rate of timely report submissions. That's our target behavior. Jane is going to give out points for submitting reports on time, and then they can exchange those points. In other words, Jane is using a token system. Part of the exam is going to be translating maybe not necessarily what we would consider traditional ABA scenarios into ABA language. Essentially, Jane is just trying to establish a token economy to increase the behavior. It's as simple as that. So when we're using the intervention of a token economy, what are we trying to leverage? A, negative reinforcement by removing undesirable tasks when reports are submitted on time. Well, we're not removing the undesirable tasks, right? We're giving the points out. And the points are going to be that reinforcement, that reinforcement we're using through the token system. Now, the employees can go and exchange the points for whatever they might want, but the intervention isn't leveraging negative reinforcement. It's leveraging positive reinforcement through the points. B, automatic reinforcement by making the act of submission inherently satisfying. Be very careful here. Automatic reinforcement just means what? It just means there's no social contact involved in the reinforcement. The person is delivering their own reinforcement, and that's not the case here. The employees are being given the points by the organization, so it's socially mediated. C, rule-governed behavior by providing clear instructions on how to earn points. Well, we don't want this to just be a rule. A rule means the contingency hasn't been met. We want the contingency to be met, so the behavior is shaped by the contingency of receiving the points and then exchanging those points. So really, the answer is D, none of the above. The intervention is not leveraging any of these answers. It's using positive reinforcement, it's using conditioned reinforcement, it's using a token economy, but none of A, B, or C. A behavior analyst is interpreting a cumulative record of a client's responding. The line on the cumulative record shows a steep upward slope for several sessions, followed by a flat line for an extended period, and then another steep upward slope. This pattern in the cumulative record most likely indicates what to the following. So I'm not going to recommend you draw things on the exam. Some people might feel it helps, some people might not. I don't think it matters either way. But if you want to visualize it, then you can quickly visualize this cumulative record. Now, a cumulative record is not something we use all that often anymore, but all it is a running total, right? So in this case, we have a steep upward slope, meaning responding has just accumulated, and then a flat line, meaning no responding, and then another steep upward slope. So what is this cumulative record indicating? Remember, a cumulative record is just an accumulation of responses over time. It never goes down because it can only add up. When we get a flat line, that just means nothing happened. So what does this indicate? A period of high response rate followed by a period of extinction or no responding, and then a return to high response rate. Yes, we've got our high response rate, no responding, high response rate. Pretty straightforward. B, a gradual decrease in response rate over time followed by a sudden increase. Well, it wasn't gradual, right? We had this steep, sharp incline and then flat. So it wasn't gradual. C, variability in response topography across sessions indicating a need for better operational definitions. Cumulative record is not going to show you any of that. Cumulative record is just an ongoing count. C is very wrong. D, a steady, consistent response rate throughout the observation period. It was anything but consistent. Steep, nothing, steep. D is out. What does the record show? A period of high response rate followed by a period of extinction or no responding, and then a return to a high response rate. An analyst is designing a study to identify how different delays and reinforcement affect a client's response rate during a task. The client is given access to a preferred toy after completing 5 math problems, but the delay between task completion and reinforcer access is systematically altered between 0 seconds, 15 seconds, and 60 seconds. What does this resemble? Let's think about this, right? We have a study. We're trying to look at how different delays and reinforcement affect response rate. The client is given access to a preferred toy after completing 5 math problems. So we're on like an FR5, right? Fixed ratio, 5 responses for 5 math problems. That's not necessarily changing. The intervention is the same. What's changing about the intervention? Well, this idea of access and delay. We're altering something small about this intervention. So when we think about altering interventions or comparing interventions, we're thinking of comparative analysis, component analysis, and parametric analysis. Let's say we have interventions A, B, and C. With the comparative analysis, we are comparing those against each other. They are not part of a treatment package. We're just comparing them, right? With the component analysis, we now have a treatment package, and we're comparing each piece of each component of the intervention to one another. So we can pull it out, we can add it in. We've got one treatment package, and we're comparing the components of that package. With the parametric analysis, we have one intervention, like this FR5, and now we're doing a dosage or an amount. So 0, 15, and 60. So in this case, this resembles most a parametric analysis. A client is taught to man ball during NET sessions in the playroom. After 2 weeks, the client frequently requests ball, but only in the playroom, and ignores the ball in the living room. Which adjustment would you suggest? Let's end on an easy one, right? We're looking for an adjustment. Now, what are we trying to accomplish? What's the issue? The client is taught to man ball, so request ball during sessions in the playroom. After 2 weeks, they're requesting ball in the playroom, but not in the living room. What's the issue? We're not generalizing. Great, we're in the playroom, ignoring ball in the living room. What adjustment are you going to suggest? A, increase the reinforcement magnitude in the playroom. Well, that'll strengthen it in the playroom, but not necessarily anywhere else. B, introduce training across multiple settings. Sure, if we want them to start asking in the living room, we need to start training in the living room. C, reduce the reinforcement schedule to prevent satiation. Well, that's not going to encourage the behavior, right? It's not going to encourage generalization to remove reinforcement. D, use discrete trial training instead of NET for better consistency. No indication we need to use DTT yet. We just need to start teaching in a different setting. The adjustment you should suggest is introduce training across multiple settings. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.